Welcome to the deep dive. Today we're tackling a topic that's deeply personal, really touches so many lives, especially, as the world's population gets older. We're talking about navigating serious illness, specifically cancer in older adults. But here's the thing, right off the bat, we want to challenge a really common idea, one that's actually pretty damaging. You've probably heard it, maybe even thought it, that palliative care, that's just for the very, very end of life, like hospice, right? Well, the sources we've looked at paint a completely different picture, much more dynamic, and honestly, a lot more hopeful. So our mission today is to unpack what palliative care really is, why it's not just, a nice to have, but absolutely essential for older adults facing cancer. And we'll get into some pretty compelling evidence, some surprising science about just how big its benefits can be. The goal is for you to walk away really understanding this vital field, maybe seeing it in a whole new light. Okay, so let's just get this out there first. That idea that palliative care means giving up, or it's only for the last days or weeks. It's so widespread.
It really is. And it causes so much misunderstanding. The actual definition, well, palliative care is a specialized medical approach. It's intensely focused on giving relief. Relief from symptoms, from the stress, the burden of serious illness. The main goal, improve the quality of life. For the patient, yes, but also for their family. And here's the crucial bit you mentioned. It's often delivered seamlessly alongside curative treatments. They happen together.
Right, that's such a massive difference. So it's not about throwing in the towel at all. It's more about making every day better, even while you're actively trying to cure the cancer. That feels, incredibly proactive.
Precisely. Proactive is a great word for it. And it's holistic, truly. It looks at the whole picture. Physically, yes, it tackles things like pain, which can be debilitating, nausea, that awful fatigue, shortness of breath, what doctors call dyspnea. But it goes way beyond just the physical symptoms. It provides really crucial support for psychological distress too. Things like anxiety, depression, even that deep existential angst that can hit you with a cancer diagnosis. And then there's the emotional, social, and even spiritual support. These palliative care teams, they're interdisciplinary. They act as guides. They help patients sort through complex medical decisions, really understand their prognosis, and crucially, make sure the treatment choices line up with their personal values, their priorities, what matters most to them in life.
Okay, so just to be crystal clear on the timing, because that seems key, this isn't something that just comes in at the 11th hour. This support system, it can be introduced really at any stage of a serious illness, from day one.
Absolutely. From the moment of diagnosis, right through active treatment into survivorship, and yes, if the illness progresses that way, through the end-of-life phase as well, it's a continuum.
A true continuum.
It really is. Yeah. And the aim, always, is to optimize overall well-being and function, to empower patients to live as fully, as comfortably, and as meaningfully as possible for however long that may be. It's about maximizing life.
Okay, so that makes sense conceptually, but let's dig into the specifics for older adults with cancer. Why is this approach particularly vital for them? What makes their situation uniquely challenging?
Well, it's really interesting there because older adults face this complex interplay of factors. It's often not just the cancer. Many older adults have multiple pre-existing health conditions already. Heart disease, diabetes, arthritis, things like that. We call them comorbidities. These can really complicate the cancer treatments themselves, and they add their own symptom burden on top of everything else.
Right, so it's layered.
Exactly. Then there's polypharmacy. That just means taking multiple medications at the same time. It's super common in older adults, and it ramps up the risk of side effects, bad drug interactions. And you also have age-related physiological changes, maybe some functional decline, sometimes cognitive impairment. These can make delivering cancer treatment trickier, make symptoms worse, or even affect someone's ability to sort of manage their own care or make decisions.
That makes sense.
And one more thing, unfortunately, is social isolation. It's a tough reality for many older people, and it can really amplify psychological distress, limit practical support, and even get in the way of clear communication with their doctors. It's a whole web.
Wow, yeah. A whole web is right. It's not just the disease, it's the person's entire context. So given all that complexity, how are palliative care teams, specially equipped to handle that? What's their unique skill set?
That's exactly where they shine. They are trained to provide these highly tailored interventions. They meticulously consider everything: the patient's overall health, their social situation, cultural background, their very personal preferences. They consistently focus on the whole person, their life, their values, their fears, their hopes, not just the cancer cells. And by doing that, they help ensure that the treatment plan isn't just medically sound, but it's also realistic for that person, sustainable,
and
genuinely aligned with what they want out of life. their broader goals.
So it really respects the individual within the illness.
Precisely. And that person-centered approach, it fosters a real sense of dignity and control too, even when things feel overwhelming.
Okay, let's shift to the impact then, because you hear about early palliative care, and the evidence seems, well, pretty remarkable, sometimes even counterintuitive.
It is transformative, and the data is strong now. High-quality studies consistently show integrating palliative care early on leads to, first, significantly better symptom control, just feeling better day to day. Second, a demonstrably improved quality of life, and not just for the patient, but for their caregivers too, who carry a huge load. And third, a notable reduction in things like unplanned hospital trips, emergency room visits. Those are stressful, disruptive, and costly.
Right, and wasn't there a landmark study, I think Temel et al., back in 2010 in the New England Journal of Medicine? That one seemed to really make waves.
Oh, absolutely. That study was pivotal. It really shifted perspectives. They looked at patients with advanced lung cancer, specifically metastatic non-small cell lung cancer, and the patients who got early palliative care alongside their standard cancer treatment. Well, they reported less depression, significantly better quality of life than you might expect. But here's the kicker. Remarkably, they also lived significantly longer than the patients who only got the standard oncology care.
Okay, wait, lived longer. Just by getting care focused on quality of life and symptoms earlier, that's the head turner, isn't it? It feels paradoxical.
It does, initially. But it points to a critical truth. When you focus intensely on enhancing quality of life, on managing symptoms proactively, providing that whole person support, it can actually enable patients to tolerate their cancer treatments better, maybe stay on them longer. It helps them maintain their functional status, avoid those debilitating complications that can really shorten lifespan.
So managing the side effects and the stress actually helps them fight the cancer more effectively, in a way.
In a very real way. It's this powerful idea that living well can genuinely contribute to living longer. It's not just about adding days to life, but life to days, and sometimes that adds more days too.
Which really reinforces this idea you mentioned earlier. Palliative care isn't an endpoint. It's more like a bridge, supporting people throughout their journey.
Exactly. That's a perfect analogy. It's a continuous spectrum of support, a robust, compassionate bridge. It's not some cliff you fall off when curative options dwindle, and that bridge adapts. Right from diagnosis, palliative care can help manage treatment side effects, make communication with the oncology team clearer, more empathetic, help plan for future care needs as things evolve.
So the focus might shift over time, but the support is constant.
Precisely. The intensity might change, the specific interventions might adjust based on the disease or treatment goals, but that fundamental commitment to the patient's comfort, their dignity, optimizing their quality of life that remains unwavering, that's the core mission.
And ultimately, that empowers people, right? Older adults with cancer get to keep their autonomy, make informed choices that are right for them, and find ways to live with purpose, with meaning, no matter what the scans say or what stage they're at.
Yes. It really champions the idea that every single day matters, and every day deserves to be lived with as much comfort and dignity as possible.
So as we start to wrap up this deep dive, the takeaway message seems incredibly clear. Palliative care is, well, it's essential, but it's often tragically underused, especially for older adults with cancer. Yet, by offering that holistic symptom management, that psychosocial support, that expert communication, it just profoundly improves the whole experience for everyone involved.
It really does. And we absolutely have to keep working to dispel that damaging myth, that misconception that it's only for the very end. The evidence is just too strong now. Early integration alongside curative care leads to measurable improvements, better quality of life, less suffering from symptoms, and yes, in some cases, even longer survival. It's not wishful thinking, it's documented.
Which leaves us with a final thought for you, our listeners, to really chew on. Advocating for early, routine palliative care and cancer treatment for older adults. Is it just about being compassionate? Or is it actually fundamental to delivering the highest possible standard of care? Truly patient-centered, holistic, effective healthcare. It makes you reconsider, doesn't it? What does success really mean when we're facing serious illness? Something to think about.